I'm also by myself today. Rhiannon had a personal situation come up and no one else from Omni was available last minute. So bear with me. Hello, everyone. My name is Dr. Chelsea. I'm the program manager for Gateway to the Rockies Opioid Council, Region 10, also referred to as GROC. Today is our July 13th executive committee meeting. We're going to start with some attendance and quorum. Commissioner Dahlkemper.
Here.
Commissioner Marlin.
Here.
Commissioner Hollingsworth.
Here.
Michael Miller. Dr. Ryan.
Here.
And Marie Larson.
Hi, Marie is here.
Thank you. We do have quorum. So general updates, Jeffco Sheriff's Office, their contract was executed July 1st, so they are starting the procurement process. Jefferson Center for Mental Health, the $2.5 million for the Soteria Landing project is on hold. I have met with Sarah Allquest from Jefferson Center and Carrie Markle, our legal, and we have agreed that Jefferson Center needs to have an internal board meeting, which is scheduled for July 16th before we can move forward with that contract. And so I will be touching base with Sarah shortly after that meeting, and then I will update this council in August. We do have our two renewal applications, Advocates for Recovery and Denver Recovery Group. Their contracts expired this year. They had 1-year terms, so they are currently doing their applications. We did have a technical assistance training with the unit implementation team on July 1st. We will be doing a reviewer onboarding to a UNA for all council members July 27th. I know the executive committee has already gone through that, but it will be a great refresher. The applications are due on July 31st, and then we will have individual asynchronous scoring August 5th to the 17th. Those will go to group discussion at the August 24th meeting. In terms of summit planning, we are at about 90 people at this point in the RSVP process. The second round of RSVPs will conclude at the end of this month. The room reservation forms have been sent over to me by Red Rocks Community College. Carrie has reviewed those. We did send back a red line. So as soon as I get Carrie's okay on that, I will route to Kate Newman, the acting county manager in Jefferson County, who has signing a delegation to sign those forms. Our budget is at $4,700-ish. So super happy I got that under 5,000. That does include breakfast from Santiago's to do breakfast burritos, our coffee from Wagon Coffee Roasters, our sandwiches from the same place that we've been ordering sandwiches from. I keep wanting to say Jersey Mike's, but that is not it. The box lunches, which includes sounds, chip, and a pretzel. I did include an estimate for drinks from Costco with ice bags, and then badges with lanyards that I got a cost from Amazon for. And I think the only thing I'm waiting on is printing, which I think Jeffco would just charge GROC a ream of paper. So super excited. Any questions on these? And Michael Miller has joined us for the recording. Okay. I think we are at a point with the recent budget cuts, just statewide, nationally, to develop some type of stewardship doctrine or release a statement of how we are going to approach this. I have been receiving an influx of emails requesting funding, mostly for scholarships or Medicaid supplements. I have been judicious with the requests brought to the council, mostly referring folks to the 2027 funding announcement. But again, we just might benefit from releasing a statement about our approach to funding, as well as beginning to think through what does scholarship support look like, or could it look like? How much of the settlement should support direct patient care versus building lasting infrastructure? If scholarship demand grows every year, what happens when settlement payments decline? What investments today reduce the need for scholarships tomorrow? Do we need revised application prompts and a scoring rubric? I did make some notes from the advisory committee meeting. They asked where this statement would live. I said it would probably be an email response, as well as live on our website at the funding announcement page. They asked if there was an organization we can work with to administer scholarships, because it's not the best use of my time as the program manager to be reviewing those. I have no time to do that. Of course, in a pie chart of 100%, we can take things out of my pie chart to create that time, but that would need to get done. And then we would still have to set up who those reviewers are, what their rubric is, how they report out to the council. They asked if I've heard of lessons learned from other ROACs doing this type of scholarship fund, and I said not really. There's only one region I know of that has this kind of set aside scholarship fund, and they recently lost their program coordinator. So that portion of their project is on pause. That region is also a lot smaller, with, I think they only have one treatment center in the region, so it was easy for them to contract and set up, where we have a lot more complexity. Who would we work with? How would we determine the allocation scholarship funds to each place? There is a significant burden on agencies who have regulations on supporting or supplementing or somehow offsetting uninsured patients. Certain programming like sober living has been cut from signal funding. So there are some scholarships for housing rent, but there is no budget to offset the cost of staff for those services being provided. There's also a large reduction in TPS. I think that's supposed to say reimbursement to Medicaid. So that's a specific billing code. And then how many requests from current grantees are there for an increase of their budget because of region budget cuts? Last week it was one. I am now at least 2 grantees who are looking into pursuing a budget amendment because of funding costs. I will pause and open the floor for comment.
Chelsea, Sandy, hi.
Thank you.
I think having a statement is good, because at least that would communicate clarity to the public, because I think this is part of that domino effect that we have kind of been discussing a little bit. As people are receiving funding cuts, they're going to be out there looking for any avenue of funding and not necessarily going to the best fit, but just like, oh, there's money there, we're going to try them. So I think having something, and then I guess I have other concerns, like if we're giving what we're calling a scholarship to an individual, is that going to be counted toward their income for their benefits? Because there's so many complexities in the application processes, having helped people with applying for benefits in the past. So I think there's just a lot of nuances that we'd have to really research more. And I also have the concern, as I've expressed before, about money going quickly and not supporting long-standing programs for the future. So anyway, my bottom line is the statement is good. I think it'll just take us a while to get there with what that statement says.
Commissioner Marlin had previously mentioned doing like a request for information. So I drafted a couple of questions. I do want to send that over to Omni to review to make sure I'm asking the correct questions. But if this group is open to it, I would try to post that sometime this week to just gather information about what these budget cuts look like, what the impact is, so that we can shape our approach. But in the short term, Sandy, if I understand you correctly, maybe just releasing a very brief statement that we understand many organizations are affected by the budget cuts, and we are exploring what that means for opioid settlement funding.
I agree with that. I think that that's wise. And we did discuss, Chelsea and I spent some time on the phone trying to figure this out last week. Um, you all probably remember that I've been talking about how to try to be prepared for a rapid response to what we kind of knew was coming here. The idea that we can backfill Medicaid on like every user that's using Medicaid for these services is, problematic. And that's where we landed on the idea that an RFI asking organizations who are impacted by whether it's changes at SAMHSA, HR1, or state budget factors, just to try to get a sense of the landscape. My own sense is that we might find some strategic investments to prop up some meaningful systems without saying that like dollar for dollar, we're going to try to have settlement dollars replace Medicaid dollars. And I think the biggest question in my mind about going down that road is one of capacity. Am I accurately kind of describing, Chelsea? What did I miss from that conversation?
No, that sounded comprehensive.
Thank you.
I'll just add that I'm wary of funding individuals because we're a small county and, our Medicaid population is much smaller than Clear Creek and Jeffco. And I think somebody would have to verify that there's a nexus to opioid funding, and like who's going to do that, and like it puts a burden on the recipients as well, like if they have to get some documentation. So I think supporting the agencies, like George is alluding to, supporting certain agencies maybe, but even those I strongly believe have to have a nexus to what the opioid funds are intended for, and not all agencies do. They support people in different ways. So I just think it's complicated. Yeah.
I agree with you, Sandy. I'm curious, does anybody else have any comments on this? I think what we're talking about is releasing a short statement saying we're aware of what's going on, and then figuring out if we can release an RFI and how to, just to try to understand the lay of the land better before we really jump into a rapid response RFA or something, even if it's prepping for January. I'm going to stop talking. Anybody else have any comments?
George, I agree with you. I do think that getting a better sense of the lay of the land, is there some connectivity with our work? But Sandy, your point, I cannot underscore enough about ensuring that there is some sort of crosswalk with what these funds are for, the substance use component, treatment, recovery, and more. So I am open to what George has laid out and how Chelsea has presented this.
I know.
Go ahead.
I know we're going to talk about this further in the agenda too, but I feel like as a group, both the executive and the whole full council, like we've already talked about whether to do rapid funding and all that, and I feel like already decided we didn't have the capacity to implement it this year. So I'm worried that we're trying to meet what we're hearing as a need versus going back and looking at capacity for Chelsea and just a good solid process that communicates really well. Until we get there, it seems like maybe we should just say that we're not the entity that's going to be able to assist till that's all in place.
Curious to hear from others. I see Tim, I see Marie on here, Michael.
I think releasing a statement is good. I don't in reality think it's going to quell the flood of emails you're receiving. I do think it's good to have a statement out there though. So I don't know if what the point of it is other than to inform. I don't think it's going to stop the flow. I do think we need to put the horses before the cart in anything that we do. I don't think this statement should say that something's forthcoming or anything to indicate to people that we're creating some timeline that they're going to hold us to day after day. I don't think that's a good idea. Simply stating the obvious to people is probably good, and go from there.
I think releasing a statement would just help me have a copy paste email response that is consistent. Like,
Yeah.
there's not much I can do. Michael Miller said in the chat that he fully endorses Commissioner Marlin's framing of the suggestion, gathering info and data on the scope or nature of the evolving conditions to compare against current GROC capacity and scope, then issuing a position or process for requesting these kinds of funds. Yes. Yeah.
So
I
sorry, I forgot you have to repeat what I put in the chat every time. I might as well just say it out loud. My bad.
Thanks. Yeah, I think even just releasing a statement like we are aware, we are exploring what this means for GROC and our approach, just like 3 sentences will be helpful. And then releasing the RFI will obviously contribute to the strategic planning summit in October. That can be used with the community survey Omni is releasing. That's why I want to check the draft questions I sent to them. Those might already be built into their community survey, or they can just sneak it into that community survey, that I won't have to do any other monitoring or analysis of that. But somehow trying to figure out the lay of the land. So I will report back to this group. I will work with Carrie on a few brief sentences. Just again, we're aware, we're trying to understand, we are discussing it. Yeah, I'll leave that at that and come back in August with more. Thank you.
Sorry, Sandy, I see your hand up.
Oh, thank you.
Yeah, I mostly like the statement, but that was Tim that was saying like the false hope part of it. I feel like I would rather have us be clearer, like even say, GROC does not fund individual requests, but rather programs, or something like that. Because if individuals are looking for money, and I might be the only one that feels that way, but I just feel like supporting programs that assist people is good. And then through those programs, the caseworkers and the program staff, they are the ones that vet eligibility and all of that.
Yeah.
Because if we make it sound like we're going to assist individuals, you're just going to get more requests.
Well, I should clarify, the request for scholarships is not coming from individuals. It's coming from like a treatment center who serves individuals so if they don't get enough money, they don't turn people away if they can't pay. They get what they can from Medicaid and then signal funding, and then they absorb the rest of the cost. So it's like a treatment center asking to offset care for an individual. It's not like John Doe sending me an email asking me to fund his treatment.
I wonder, Sandy, if this will, because I think I agree that we need some expectation management here. And I wonder if it's just the statement expressing in some way that we don't have to write here that we're well aware that the scale of what's happening, that GROC funds can't fill all that in. And so, we're going to try to figure out how to be strategic and prop up systems, but that we cannot backfill all of these losses. Does that something like that sound?
Yeah, because that's what we've been talking about. Like we can't, and the money has been acquired to address certain things, and that's helped to support a specific population of our population. So I just worry it's everyone that has had a budget cut. Like we've had a request, right? Everyone that's had a budget cut is like, oh, let's ask the opioid council because they have millions of dollars. So I think just to be clear as possible that that's not one, the intention, nor are we ready. But yeah, we're absolutely aware of the situation, like you say in your statement.
I think we should be careful without too many words, only to be pointed out later of examples where we've done that. So I would just be cautious as to what words we choose to use.
Carrie, do you feel like you have enough context from this conversation to help me with the draft of this
Yes.
statement?
Yes.
Okay, perfect.
Yes. Thank you.
Thank you. So this leads us into the conversation of I do try to be extremely judicious with the requests I bring to the council based on our current policies, our funding approach that we have published. But sometimes I do get a request that I am not comfortable being a decision maker of denying, and that it needs to come at minimum to this council. So Hard Beauty is requesting funding for basically a bridge award. Hard Beauty provides labor and delivery recovery. They provide recovery support services and case management to pregnant and postpartum women with substance use disorder. Region 10 has 2 hospitals, Common Spirit and Intermountain Health, or Lutheran Hospital. Common Spirit does not have a labor and delivery department. Only Intermountain Health Lutheran Hospital does. So Hard Beauty has been providing services within this hospital. They lost their signal funding in June of this year. The Stedman Group is funding them for July of 2026. So they are approaching GROC for funding. It was initially for 12 months. So it'd be August of 26 to July of 27. I don't think that is possible or realistic. To me, this fits more into a bridge funding for the rest of 2026 while they approach other funding bodies like the hospital itself. So based on the budget, and I did share these application or this proposal material in a separate attachment in your email. This comes out to, it's actually 11,000 even, because the initial budget had a 15% indirect, but we only allowed 10%. So to fund their operations through the end of the year, that would be 5 months, it would be $11,000 flat. I think this fits into sole source funding because, again, they are the only provider doing this specific service. Hard Beauty did apply in our 2025 RFA, and they did not advance past scoring, but the reviewers were highly interested in the project. I think this is another one of those, they do really good work, but they're not the best grant writers. And so just communicating their exigency and their need could have been improved. I will pause here and see how the floor opens.
Chelsea, I have a really
Yeah.
quick follow-up question. You mentioned that they work with moms with substance use issues. So what would the money fund exactly? Do we know a little more precisely? Is it treatment? Is it recovery?
It is the recovery the peer recovery services and case
Okay.
management. So there
Okay.
is an attachment, and I'm sorry I did not get to bump up your emails today.
That's okay.
Um,
Sorry.
but there is a budget with an info packet of exactly what they do. They would be required to submit our GROC Exhibit E budget template to show more precisely where the dollars are and where they go. If this council thinks this request should advance, Raquel would have to have that information to me by July 20th so that it could be reviewed by the full council on July 27th.
Just a quick thought from me. I would be comfortable advancing this for the council's full review. And I also think that this would provide us with an opportunity to get to know this organization better. Of course, we'd want to make sure if we approve it that it meets our criteria. And I think it's also one of these projects that we've talked about, and I agree too, it's more this bridge loan, but is this something we'd want to look at again in the future? I also like the fact that they have come to us in the past. I hear what you're saying about the grant writing, perhaps not being as tight, as what we might look for, but my inclination would be to go ahead and advance this, barring other concerns.
The advisory committee felt the same way. We do have an advisory member from Lutheran Hospital. There was determined not to be a conflict of interest because she has no budget authority. But generally they felt like this was a vital service and the only available service in Region 10. So a short-term bridge sounded reasonable. The advisory committee member specifically from Lutheran did describe the community benefit fund. And it has to be aimed out at the community. But the starting point of Hard Beauty is in the hospital as a patient. So our advisory committee member doesn't think they would qualify for the community fund by the hospital. They might qualify for foundation funding, but all of that has been allocated for 2026. So they would be looking at a 2027 takeover. Another advisory committee member asked about, oh, I already answered that. Yes, those are all the comments. Floor back open. We do have Raquel Garcia from Hard Beauty here with us if this council would like to ask directed questions, but I'll defer to Michael Miller first.
Disregard. I'm gonna hold on to it for a while. Sorry about that.
I mean, I personally think this sounds phenomenal. I think this is an area that's pretty underrepresented. And, I don't hear much about this kind of a program. So I would also be on board to fund them. And it sounds like if they don't get funding from us through 2026, I mean, what would happen? Would they just pick back up in 2027? Or I guess that's my question.
I don't want to speak for them. My assumption is that if they did not find funding, if we did not provide the funding to bridge the rest of the year, that the program would just come to an abrupt halt and cease to exist.
Raquel, I saw you come off camera. Oh, sorry, Dr. Shore-Miller. I didn't mean to interrupt you. Raquel, I saw you come on with your camera. Do you want to answer that question?
I can. Yes, the programming would cease. There is no additional way to fund the program.
And then I see, and Chelsea, I know you've got lots of screens going on. I see Michael Miller's hands up.
Thanks, Commissioner Marlin. I thought of the one piece that I was kind of concerned about looking through the context package, which is brilliant. Thank you for providing that level of detail. That was really helpful. The one thing that I would hope to see as we consider this decision is some of the outcomes data beyond like demographic and number of people served, just any outcomes data based on the program logic model that I saw in the package.
As a GROC grantee, they would work with Omni to figure out exactly what data they would need to be collecting to satisfy the council's strategic plan. So that might not be something that is immediately available by July 27th. But again, we do have Omni to support that.
And I more so mean like previous
Okay.
outcome measures based on like previous funding or within the logic model that they shared. It looks like there's already some things like participant and provider feedback or input, like measures they're already running from the program since it's been in operation. I'd be curious to see what those look like.
Okay.
But I do appreciate our robust eval measures.
And then Raquel, I have a question. Can you just describe, this is probably in my email somewhere, but can you just like a short version of the funding loss and what precipitated it?
Yes, Signal Behavioral Health had this under a high acuity navigation program that was actually sunsetted across the state. So it wasn't just us. And we were the only ones that were funded for the perinatal response. And then yes, back to the like, being able to give also participant and provider feedback. Yes, we can absolutely do that, just so you know. And so we didn't find out till about June 22nd, but I had anticipated this mainly because of the governor's budget cuts. I watched the $1.6 million come across and had a feeling that this was going to be one of the programs, and it came to fruition.
Thank you. I am happy to share my perspective on this, but I don't have to jump. Does anybody else want to jump in first?
I was just
Sandy,
asking,
I see your hand up. Sorry.
Yeah, mine are just more general informational, and I apologize if this was in the materials because I did not read all of it. So I was just wondering, like, how many have been served, how many are in the GROC region, if people come from other areas to use the labor and delivery. And I appreciated hearing that this is really for the recovery and case management support part, because when I first read it, I'm like, no, we can't fund labor and delivery. And then what are we looking at the potential future end to the program anyway, if there isn't ongoing funding? So like, I know you're working on some other avenues for funding, but like, what is the outlook for that? Those are some questions. Thank you.
Raquel, I think those are questions for you.
There are some working with Lutheran. We are going to look at some other opportunities for like the foundation funding that Chelsea had spoke of. And since it's so unique, we still have to think about how to it. We're the only ones that kind of do this response program in the state of Colorado, so we're still exploring those. And I know that I gave Chelsea, Dr. Chelsea, some information on the demographics for like what was exactly responded to within the Gateway region. So I know that I don't have them off the top of my head, but I know that Chelsea has those. Thank you for that, Chelsea. And then, like I said, I could also provide that participant and provider feedback. We had explored Medicaid also as an opportunity. Sometimes that doesn't work because not everyone has Medicaid as a payer source. And if they have standard insurance, standard insurances are not going to cover recovery support services. And then right now with just Medicaid in general, it's just kind of a not supportive measure for, honestly, for response programming. It just can't sustain it. There's too many limitations. Medicaid would require me to almost have them go through almost a full biopsychosocial before I come and respond. They don't consider necessarily the hospital sending me a referral because it's referral. It's generated by the hospital, should, in my opinion, be the reason why it's an acute service, but Medicaid doesn't seem to agree with that yet. something I'm working on. Obviously, I've worked with a little bit with Medicaid to see if we could build this out separately within Medicaid for a response, but it'll take me a year or so to work with them to see what's going on there.
So Raquel, if there isn't, like the worst case scenario is no funding, you poke it, you turn over every rock and there's just no funding. Will the program then it'll end and people will have to try to piece together any level of support from other places?
Yeah, we're working on some fundraising opportunities because it's so unique, and the population perinatal substance use disorder is something that community kind of avoids, but we exist. I mean, it's my background, myself personally. And so we're working on some fundraising measures, but yeah, the program will cease to exist. And I think that was the challenge. You know, when I first went around, I went to 28 hospitals in the state, and it's not that people don't know how to care for the physical person. It's the recovery support services beyond where I saw hospitals struggling to help bridge that work between L&D, labor and delivery, Department of Human Services, all of that. And like we just did a big response for 2 days this weekend on a hospital that was actually Good Samaritan's Hospital, but that mom was only allowed to go home with baby with a plan of safe care, and we can implement plans of safe care also, which seems to be really supportive in keeping that continuity of care and the families together.
Thanks, that all helps. I know we just met at the conference, but so I'm a social worker, and so I know the value of case management, and I know that, you know, some places will say they do resource referral, but they just give somebody a list, and then that leads to nothing because the people don't have the time and energy to follow up, and it's very fragmented. So listening, it sounds like this is really a well-coordinated program and
Especially when
supports
you're a
the
new
mom.
mom, you know?
Yeah, right, right. And I know like in our county, I think the other counties too, there's like a program that's being revived, and it's for visiting new moms in their home for a time period, you know, but that's in process and that's for the general population. But anyway, given everything you've said, I also would say I would support just bringing it forward now that I understand the request better. Thank you.
Thank you, Sandy. Other comments? I don't have to hide. I mean, I also agree that this should move forward. My questions mostly are not at Raquel. This, in my mind, just fits really squarely in what we were just discussing, which is how can we prop up systems in ways that are like considerate of the use of our resources, and not like, you know, trying to save everything. $11,000 for a year. What I think about is people that are currently in your program, Raquel, and what happens if services just evaporate. And I think that's probably why you're seeing a response like this. I'm curious at this point. We've heard some people suggest that we do want to see this move forward. Is there anyone who is opposed to that direction? Okay, I don't hear anybody speaking up that they're opposed to moving forward. My questions mostly are like process related, which is just, I see, Dr. Shore-Miller, you're suggesting we interpret this as a sole source application.
Yes. My concerns are around fairness and setting precedent for off-cycle funding. I don't want to call this rapid response, because if we call it a rapid response, then we need to open the rapid response funding mechanism that we have determined there just is not capacity for it this time. So to justify that off-cycle funding award, this does fit within our sole source mechanism. This would be the first, similar to the JCMH Soteria Landing being our trial project for special projects. This would be our trial for refining the funding mechanism of sole source. Do we want an application? Do we need a rubric? Are we going to use just the same special project application and rubric? I think that would work. And so my concerns are really about like the process.
Yeah, and I know, I mean, we had kind of a long conversation about this. I think at this point, for the sake of time in this meeting, I think it's very clear the outcome is we want to see this move forward. And maybe we can ask if anybody disagrees with me on this, just that we look a little bit more carefully around when I read our SOP on rapid response, it seems to me like we can define a need for rapid response around this very limited service, right? Peer support for folks, and then like have it be closed and not be like trying to like open up the floodgates on the conversation about everybody that just lost funding. But I understand the hesitance and mostly the focus on bandwidth. I worry, friends, just so you know where this is coming from. I view sole source more as like, as a result of an internal conversation, we decide there's a service we need and we use sole source to go seek it because we know there's a sole source. And this is pretty clearly coming as an external request. And that's the thing I just want to make sure we're square on. So if you all would indulge that, you know, this maybe could show up by the time it makes it to the larger council, like in one form or another, but that we all do want to see this application move forward and the body consider the funding itself. That's the most important piece. Are we good with that?
Yeah, I am. I have one additional question. Maybe it's for Raquel too. So it's about the timing of having money in hand, because if you're funded through July, but the council's not going to talk about it until July 27th, do you have funding for August at all? Or is there some flexibility in the funding that you have now or with Lutheran? Will they know that if it's forthcoming on the 27th, will they kind of float you sometime until you actually have money in hand?
Well, a blessing is that we actually starting a pilot program inside the emergency room, also at Lutheran with the Stedman group. And so they've agreed to let me use, as long as I don't go over my budget within the ER space right now, and I keep that I can hold that. So I'm watching my dollars. I can't guarantee anything, but right now we will be able to probably hold it until, if you guys are working on that for August. The Stedman group has agreed to allow me to bill some of those services, because we did have a case where actually came through the ER, moved it to the LND, and so we would have been asked to respond to both spaces. And this is why I approached Stedman and said, would I just say, no, I can't go to the labor and delivery? That would feel very awkward to me, to show up in an emergency room and not be able to follow that woman who needed my services in labor and delivery. And so they agreed to support me until my funding's done, and my funding will be in August for this pilot program.
So just, I want to wrap up a couple clarifying questions. So if it's discussed at the 7/27 council meeting, we would immediately start the contracting process that could bill through starting August 1st. And so, Raquel, just so you know, we use a reimbursement model, either monthly or quarterly. We can discuss if it needs to be more frequent or less frequent. But we would be able to effectively start the billing as August 1st. And I would imagine that contract could be done by August 31st. And then I wanted to go into, again, just a process question of, so should I have Raquel use the special projects application in a UNA with that rubric for the 7/27 council meeting, so we have more of these explicit answers? Or are we just gonna drop this proposal as the executive committee has seen it to the full council with our budget template?
So that's a good question. And Tim, I saw your hand come up.
Yeah, I'm just, Raquel, I'm just curious as to the 11.5. I mean, you don't really know how many mothers are going to walk through the door, right, in any given month. And if that's 11.5 is the bare minimum, based on what you project you might see in the next 6 months, and if so, I don't know. I can't advise you on, you know what I mean? Like, I don't know. I don't know if asking for the bare minimum is maybe the best thing.
Thank you, Tim. On the question, Dr. Shore Miller, you're asking which I think if unless there's a legal reason not to, I mean, I think there's enough information in what was provided to the executive committee, given the scale of the request and the urgency here. But if there's a legal reason to do a more formal application, then I'm happy to leave that to you and Carrie to figure out. I'm curious if anybody else on the committee has any other thoughts than that.
I actually like the having the application completed. I don't know. I think it's going to be kind of fill in the blank at this point because so much of the information has already been articulated. And the reason is for transparency and equity so that others will be like, well, they hardly had to say anything and they got money. So it would just be for a continuity, like everyone's still using the application because since we're clear we're not doing a true rapid response as we've discussed for months, I think that would be helpful for those reasons.
Anybody else have a competing opinion? Or Sandy saying yes, she'd like to see the application. I can live with that.
I would also just feel more comfortable with an application. Again, just for consistency, having that budget template. We can use that as, again, the introduction to a UNA.
Then we'll go with an application unless someone protests right now with an alternative.
I want to go back to Dr. Ryan's comment. Again, I apologize. I'm by myself trying to take notes, monitor chats at the same time. Dr. Ryan, were you saying she should ask for more than just the 5 months of bridge funding?
Yeah, if I legally can say that, yes.
Okay.
If not, I retract the comment.
I think if you guys would like to see the full request, she can definitely do the budget template for the full request. And then provide the option of just the 5-month bridge. That way, again, the committee has options, so it's not an all or nothing award.
And that'll be able to help us see it in context. So like a full cycle, just to help illustrate it for us. I think that would be helpful.
And we've had others do that where they're like, this is the full cost, but we're asking for this part. And then we talk about it and decide somewhere in between there. So it'd be helpful to see.
So I would just ask Raquel to make it, again, trying to move all of our awards to that calendar year, that it would be August 1st, 2026 to December 31st, 2027. That way it aligns with our next RFA. And then she would still be able to apply in the 2027 RFA. It would be part of our 6 renewal applications for the year of 2027. We need to talk about that too at some point. Again, in the interest of time, I will move forward. JCPH milestone discussion. This was, again, a conditional award for 1.5 million at the June 22nd council meeting. The council delegated the budget finalization for phase 2 of the project to the executive committee. They did request that JCPH modify the budget through December 31st of 2028. So there's a little over 2 full years of direct services. The line item budget was reviewed for supplantation based on guidance from the COAG, the Colorado Opioid Abatement Council, the state council. Amber and I did review this. We had a meeting with JCPH. We are satisfied with the budget difference, and we are making a recommendation to the executive committee that they approve the line item budget. There is a budget difference of a little over $6,000 to account for that extension. This is not larger because JCPH has removed the leasing request line item because at this time they do not have the formula or information of the location required that Amber and I need to determine it's not subplantation. So for the sake of, again, moving this award forward, we recommended they just remove that line item, and then when they have that information, come back to the council for a budget amendment if they can answer those subplantation questions. Floor is open.
Thank you, Chelsea. So far, I don't see any hands. Who wants to go first? In that case, I'll go first. Thank you for getting to a place that you're comfortable recommending that this is not supplantation. And my opinion is that we move forward based on your recommendation. Does anybody have a different thought?
This is Leslie. I support.
Do we need a motion, etc.?
Yes.
Okay, I will go ahead and move that we accept the recommendation to approve this budget as presented.
I'll go ahead and second.
Vote by opposition in the chat. Oh, no on abstaining. Michael Miller is abstaining. I'm not seeing any concern, so I will work with Carrie to get that finalized. Last agenda item I have before releasing you into executive session is the July 27th full council meeting agenda. Oh my gosh. Attendance and quorum, approval of June minutes. Oh, that says 7/9. That should say 7/27. Conflicts of interest, our monthly expense report. Jeffco is going to be updating their language around their membership in our standard operating procedure manual. So that should just be a quick vote to approve. And then we will have general updates, same thing that this council has seen for the JCMH Soteria postponement, the Jeffco Public Health Phase 2 award notice, summit planning update. Then we will have a brief presentation from the 6 people we sponsored to attend the National Opioid Conference. We will revisit the conflict of interest statement. Carrie's reviewing that this week for the, just conceptually we're all on the same page, but that way it's in writing. I can take that off as an agenda item. We will have the hard beauty discussion, and we will have, I'll probably do the EUNA reviewer onboarding first and then hard beauty. That way folks can actually like move through how they should be using the system. And I will be sure to include a printout of their application in the email. That way folks who are struggling with getting onboarded to EUNA can still review the application materials and contribute to the discussion. Is this good to go?
I think so. Any comments? Anybody have any suggestions?
I just have a question. I know we've been alternating locations. Are we gonna keep trying to meet in person? Because the last time I drove down to Jeffco, there was like 3 of us. So
We can. So the September the August meeting is supposed to be in Jefferson County. September is virtual. October is supposed to be in Gilpin, but we're canceling that for the summit that is in Jefferson County. And then we had decided to do November and December virtual. So we can make the August meeting fully virtual and then decide at the November meeting if we wanted to continue with in person.
Are any non-Jeffco people planning to go down for this meeting? Or would you just appreciate virtual?
I know virtual works a lot better for me. I'm often the only one in the office, so I can't usually leave.
Sandy, I usually play it by ear and frequently end up with some other meeting, like starting immediately before or after. As is the case on the 27th, so I'm likely to be virtual.
Of August, I will just go ahead and make the August meeting virtual and then make sure that I add this in November. Well, September is when I'm gonna plan to do 2027 scheduling, so I'll bring this up as a discussion. And with that, thank you all. George will drop a link in the chat for the executive session. The public cannot go to that. It would only be voting members and legal. This is the executive session, role development of the Opioid Council Program Manager. It's a personnel matter, CRS 24-6-402 4FI.
And we'll need a motion and a second on that.
Okay.
Yes, Carrie, typically I am used to saying I move into executive session for the following purposes, and then you state the purpose. Are you good with that?
Perfect.
I move that the executive committee of the GROC enter executive session for the following purpose.
To discuss a personnel matter regarding the role development of the Opioid Council Program Manager pursuant to 24-6-402 4FI.
Okay.
I'll
Can I-
second.
Thank you. We have a motion and a second. All in favor?
Aye.
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 Okay, that motion passes. We get a Zoom link into the chat before you all leave. I will also just put it into the email too in case someone needs it after they leave. And I'm sorry, I'm on a device that I'm a little less familiar with, so.
Thank you, Raquel. So I will follow up in an email on next step.
I will have to hop off, but let me see if I can join you from the car. I will just say WebEx is always an adventure for me in terms of whether I can connect or not. And we're looking for the link in the chat, right? So I'm going to have to jump off here. Awesome. Zoom, perfect. Thanks.
Did everyone get the link? I can close this room. It looks like everyone's gone, so I'm going to close this room.